Good evening and welcome to another segment today, this Tuesday evening of Ngima Makare. My name is Bramwell Asere and I am thrilled to have you on board. Today, we are going to cover a very interesting topic. I'm talking about plastic and cosmetic surgery. And on board with me is none other than Dr. Nelson Oduor. Dr. Nelson Oduor is a consultant plastic surgeon here at Aga Khan Hospital, Kisumu. Daktari, karibu sana.
Thank you very much.
I'm happy to have you.
I'm happy to be here too.
All right.
Yes.
Let's dive in.
Yeah.
For starts, kindly, briefly, just give me a brief introduction of who Dr. Nelson Oduor is and what do you do?
Right. So, like you rightfully said, my name is Dr. Nelson Oduor Bouma. I'm a plastic reconstructive and aesthetic surgeon. So, what that entails is we do a lot of reconstructive work, and we also do aesthetic work, where the reconstructive work involves trying to regain form and function, where that has been lost due to very many reasons, from pathologies, infections, trauma, accidents, and those kind of things, malignancies, problems that can deform the human body. The aesthetic aspect, which is also part of plastic surgery, is where now we try to make appearances a bit more good for the patient, as pertains to how they want us to help them. Right.
Thank you, Dr. So basically what you're telling me, you've already jumped into my answer for the first question, which was what is plastic surgery?
Okay.
But what you're trying to tell me, there is a difference between plastic and cosmetic.
Correct.
Yeah, which is one alters and the other is for
Trying to,
deform or what?
So, from the definition, the word plastic surgery comes from Greek terminology plastikos, which means to mold. So when you understand the word molding, means you're defining shape, you're defining form, you're trying to alter some structures and trying to emulate how they're supposed to be in the normal way. So you find, because of various reasons, the normal structure of the human body may be altered due to disease processes. So these disease processes could be as a result of trauma, so accidents, can be as a result of infections, so can also be as a result of malignancies and tumors. So when those ones happen, then you find plastic surgery comes in to help restore the lost form and function using various techniques and maneuvers that we've gained in school and honed during our practices. The other aspect of plastic surgery is the cosmetic or the aesthetic aspect.
Cosmetic or aesthetic?
Cosmetic or aesthetic, right. So plastic surgery, there's the huge arm which is reconstructive arm, and then there's another arm which is aesthetic and cosmetic or cosmetic. So the reconstructive one is the one we've detailed and explained. The aesthetic or the cosmetic bit is where now more or less the patient is in normal form, but maybe not so happy with a few things about their body that they would want to be altered.
Now that's where the cosmetic.
That's where the cosmetic or the aesthetic aspect comes, in that they may not necessarily, have any life-threatening or limb-threatening situations, but because of one or two reasons, they're not happy with how they look or how they feel. So the cosmetic or the aesthetic aspect helps to define that and bring a solution to that.
Thank you. Do we have any other types of plastic surgery apart from the ones you've mentioned?
Well, plastic surgery has very, very many subspecialties. So being a plastic and reconstructive surgeon is just one huge umbrella under which there are now various subspecialties. For example, there's the breast part of plastic surgery, there's microvascular plastic surgery, there's hand surgery, there's
nose surgery.
yes, there's free things to do with microvascular and free flaps. So
Microvascular.
microvascular.
What is that?
So microvascular surgery is a very interesting aspect of plastic surgery because from the name, micro means very small, tiny, probably not perceptible with the human eye. And vascular is from the word vessels. So in brief, microvascular surgery entails working with vessels which are sub-millimeters or vessels which are very small enough that the normal conventional way of repairing tissues is not feasible without the use of microscopes. So you either use a microscope or you use some form of magnification to enhance the dimension, the size of those vessels that you hope to reconstruct in the human body. Say, for example, a patient has a very devastating injury from a road traffic accident or from assault. And you find that in that location, there is just a defect which has been created, either by the accident or by a tumor process like a malignancy, like cancer or something. And so the doctor will, for example, it's a tumor, the doctor will cut out that deceased part of the body and leave a huge defect. Now that huge defect becomes the burden of the plastic surgeon to figure out how to close it, because there are some vital structures that are not supposed to be exposed to the environment, that skin is supposed to cover and to protect the internal architecture of these organs. So you find that with conventional surgery, the expertise and the amount of tissues which can be used to cover that defect may be limited. And so the surgeon, the plastic surgeon, the microvascular surgeon has the expertise to transport tissue from a distant anatomical region, a distant part of the body, and bring it to that area which has that tissue defect, which we said could be as a result of either tumor process or excision has been done, or could be as a result of accident, so there's been tissue destruction. And so the surgeon transports this tissue from a distant region with its blood supply and brings it to the new area of focus to be reconstructed. And because these tissues can't survive without their own blood supply, it means the surgeon has to do microvascular surgery, meaning those small vessels with the tissues where the surgeon to go to these tissues have to be connected to the tissues where the defect is. So that's where the microvascular aspect comes in. It's just a matter of free tissue transfer. It's a bit complicated.
Yeah, it's a bit complicated. When talking about microvascular,
Yes.
I'm trying, my understanding is, and I'm trying also to make it explainable to a layman back at home.
Correct.
You're talking about surgery which is under the skin, yeah?
Correct, sir.
So basically we have surgery which you can do on top of the skin, which is the dermis, and that which you have to do under the skin. That's where you're talking about tissues and all that.
Yes, yes.
Now, what kind of surgeries do people usually come for, within your experience?
So, in my experience so far, most of the surgeries that we happen to do are reconstructive type of surgeries, because you find that in our population, most of the patients have defects that have come as a consequence of either infectious processes or trauma or malignancies, tumors. So that's the biggest burden that we have in our locality, the reconstructive aspect of plastic surgery, as opposed to the cosmetic or the aesthetic. Maybe geographically that can be altered if you go to other cities, other places like Nairobi, or where maybe the cosmetic or the aesthetic demand could be higher as opposed to the reconstructive. But all the same, with plastic surgery, most of the population, we see the demand is usually to do with the reconstructive aspect, and then the cosmetic or the aesthetic aspect gets to blend in amongst specific patient demands.
Yeah, I'm trying to imagine the young people with the influence from social media and stuff,
Right.
trying to look what celebrities are doing, but we'll come to that.
Correct.
Now, I think we just jumped again a little.
Okay.
What inspired you into this? Is Is it something you're dreaming of becoming ever since you were a kid? Is it something you just decided maybe after secondary education that this is the direction that you're going? What was your inspiration for this?
It's a very interesting question because I've been asked that question a couple of times. What inspired me to be a plastic surgeon? But in retrospect, from the beginning, I never even envisioned to be a doctor. What I was supposed to do and actually was called to do at the University of Nairobi was architecture.
Architecture.
Architecture is what I had applied to do. But then it happened that there was an opportunity to study medicine in Russia. So one of my mentors is a city lawyer in Nairobi. So he advised me about, doing medicine as opposed to other careers, other choices, including architecture. And after our thorough discussion with him, I realized that he was putting more weight on the aspect of me being in a medical field, being a doctor as opposed to being an architect. So that's how I left my ambitions to be an architect, and I went ahead to study medicine in Russia. Now, when I started off, I wasn't really sure of what specialty I was going to focus more on. But I think as time went by during undergraduate studies and during my exposure in the medical aspect, I got to gravitate more towards plastic surgery, and I was more fascinated about the aesthetic or the cosmetic aspect.
That is exactly where I'm coming to.
Exactly. I wasn't really so much into the reconstructive bit. My mind was more of, making people beautiful.
Making people smile.
Making people smile, you don't like this about you, then, we sit in a consultation and we discuss. Maybe you have breasts that, are too big, or, they're sagging and you want them shaped nicely and all that. So in my mind, that is what I thought plastic surgery was all about and all I needed to do. And I thought that was, the cosmetic aspect. But later on, as during my studies went on and the experiences, I realized that I'm doing more of the reconstructive work than the cosmetic or the aesthetic one, even though we have enough exposure to handle both aspects of the field. So yes, so my reason to be more of a plastic surgery was the feeling that making people smile and happy and, content with their body, regain their self-esteem, was a good motivation for me to be a plastic surgeon.
So far, do you think you're achieving that?
I'm achieving that because some of the responses that I get are very much positive. Even with the reconstructive work, not only do we repair tissues and, restore form and function, but we try to do it in a beautiful kind of way.
Yeah.
So even where patients feel like, they had lost some function, some limb, a wound they'd had for a long time, has healed, it heals beautifully. So I think I'm able to achieve both aspects of, helping patients regain their self-esteem by reducing their burden, and also try to make them more comfortable, integrating and happy, integrating the society, yes.
Except you mentioned something about body parts that are sagging, which has to do with reconstructive surgery. What are some of the reasons, some of the common reasons that people nowadays come for cosmetic surgery?
Correct.
Yeah.
So there's a very thin line between cosmetic surgery and reconstructive surgery. And one thing that may bother patients a lot, to someone else may look like, it's not so necessary, maybe they don't need to have it done on them. But then, for example, the way you've asked me a direct question about sagging. So we'll discuss a little bit about, enlarged breasts, which could be sagging as a consequence of different reasons. Post-child, post-breastfeeding, childbearing, sometimes even post-pubertal, because of hormonal influences, these tissues respond to huge, but they also cause them more physical problems. Because you can imagine if you are a lady who has very huge busts, huge breasts, and they are hanging, so even getting the right bra size becomes a problem. Because of the excessive weight, there's constant pain,
It's a burden.
back pain, neck pain, chest pains, because you're carrying weight in front of you. Some bras have some strapping on the shoulders, so because of constant weight, there's shoulder groovings. Because of the constant weight and moisture effect underneath the breast, you find sometimes there could be some skin rashes and irritations, constant headaches and pain. And it can even get worse because of self-esteem issues. You find that these patients are not even confident enough to even leave the house or engage in social events and activities that their peers go through. So this, to someone, if you talk about doing something like a breast surgery, like a breast reduction, maybe someone who's not very well conversant with the symptoms and the problems these patients go through may think
That's what you call it, breast reduction.
Exactly. That's called a breast reduction. When you have enlarged breasts, we do something known as breast reduction.
So when you say breast reduction, you know,
Yes.
so to any other person who might feel back at home, people are afraid of the knife. So a layman will think I'm going to have my breasts chopped off.
Okay. That's another term that's called mastectomy. So
Mastectomy.
mastectomy is chopping off the breasts.
Mhm.
And those breasts can be chopped off mostly due to breast cancers.
Breast cancer.
So if
This
you
is
have
not reconstructive.
that's a therapeutic treatment to remove the tumor from the breast. That's called mastectomy. And even on top of that, even after doing mastectomy, which general surgeons and breast surgeons do, we usually do breast reconstruction,
Breast reconstruction.
where now our expertise is involved. Because breasts have a special role, and there's a special way that they look. So you find that they need to have both projection and profile. So projection means how they point and they look forward,
The shape.
the shape and all that.
Yes.
So you find that after a procedure like mastectomy, a lady can have just a flat chest, which again may be troublesome in terms of the outlook and even the confidence, the type of wear to take, to have, the wardrobe. So that's where now the plastic surgery aspect of breast reconstruction comes in. And there are so many different armamentarium of breast reconstruction. From your own self-tissues, so autologous breast reconstruction, to synthetic or foreign materials like breast implants, to a combination of both of those things, all in all to achieve a desirable result that the patient and the doctor agree upon during consultations.
Now, I'm happy you mentioned breast implants, and I would like to know what kind of breast implants you're having. But before we get there, I'm also trying to imagine that you have kids, yeah?
Yes, I do.
At what age do you feel comfortable? Do you think you will tell your kid comfortably, you can go and have cosmetic surgery? Your teenage kid.
Yeah.
And why would you advise them? Do you think it's something advisable? Do you advise them to go and have cosmetic surgery?
Well, in my opinion, cosmetic surgery should be a choice left to adults who can make informed consent. Because when you're going to have a consultation with the doctor, there are so many things discussed during the consultations, which would border both the treatment and the outcomes, the implications of the treatment, the alterations that are going to be done on the body. And because when you talk about purely cosmetic surgery, then you're more or less talking about a healthy patient,
Yes.
a patient with no health problems, but who will just like a few alterations done in their body. And I think for that to happen, informed consent, which can only be given by adult after varied consultation, is good enough. So to answer your question, I think the consenting age should be good enough to allow a patient undergo cosmetic surgery. But like we said, there's a very thin line between cosmetic surgery and reconstructive surgery. There are some patients who, even after their puberty, so maybe when they're 16 years old, 17 years old, you find that because of various reasons, they can get these hypertrophied breasts that can also still give them a challenge. So the same symptoms we've discussed that can appear for a patient who's an adult with enlarged breasts can also appear for a teenager with enlarged breasts. And so depends on the symptomatology and the pros and cons of doing the surgery vis-a-vis, waiting for other factors to come in place to help make the decision to be involved in surgery. So yes, there are some teenagers who also undergo some form of reconstructive work that will more or less kind of border into cosmetic, but are purely aimed at bringing symptom relief to the patient rather than purely cosmetic aspect.
Have you ever had the opportunity of talking someone out of surgery?
Many times.
Due to, I know there are different reasons.
Many times.
Could be maybe health reasons.
Right.
Maybe their health background.
When we're in medical school, we are told that a good surgeon is one who knows when not to cut. So when we meet patients, we go through all the reasons why they should have a cut, and we give them the alternatives of why, other forms of treatment, conservative treatment to this case, can also play a role. So our job is to help the patient make informed consent by making the patient autonomous. So we provide the information, and with our guidance, they're able to come to the decision that they think is best fit for them, and also within our agreement. So if at all, for example, a patient wants something done, and I don't really think there's much benefit patient's going to gain from that and all that, yes, I can have all the reasons to decline and try to talk the patient out of it. Of course, a patient may listen to you, and that will be the end of it. But again, patients can have several sessions and other consultations where other doctors may be in agreement with my opinion, or some may still go ahead and do as the patient wishes.
Very good. Now, let's talk about aging, because I think that is one of the reasons most of the people maybe nowadays are a bit uncomfortable with their surgery. Do you think cosmetic surgery reduces aging?
Reduces aging?
Yes.
Aging is a process that can't be reduced. I think what cosmetic surgery tries to do is try to make someone age better. So, for example, when you talk about aging, the obvious things that you see when someone ages is skin wrinkles, sagging skin, maybe skin which seems to have been sun damaged, so overexposure to the sun.
Breast shaping of the breast.
Or even all that, the weight of gravity. Gravity has an effect on all our body parts, including even our face. The more we age, things become loose and saggy and all that. So when it comes to the aging face, for example, when such a patient approaches a surgeon, it's not to alter how they look, but it's just to enhance how they look in their old age. So what plastic surgery tries to do is just to try to enhance the form rather than, give you a new form. So we just, for example, it's the wrinkles, we help you to wrinkle better. So we can try some skin tightening maneuvers. We can try some injections, some botulinum injection, We can try a few other techniques to make those features less prominent and therefore less perceptible to the other population, who may make the patient more aware of their self.
Yeah. Well, hold on to your thoughts, Dr.
Okay.
Viewers, we're taking a short break, and when we come back, we will definitely talk and cover more about human stories. We'll also look at trends and social media. Remember also, you can send your questions. You can find us live on Facebook on Color TV Live, and YouTube on Color TV Live. We'll see you back shortly after this.